Oh my goodness, I gained a lot of surgical knowledge for sure. I wouldn't say skills because I didn't participate in it, but it was cool to see and very cool to learn from surgeons. In terms of skills, I feel like I may have gotten better at interviewing because I got to see so many types of interviews in terms of like psychiatric interviews, just CCU interviews, or just gathering patient information. So it was really cool to get to see different patient interactions, and hopefully I picked up some of those skills.
So I got to see the OR. I shadowed an orthopedic surgeon, Dr. Tran. He was amazing. He taught me so much. He quizzed me on everything I didn't know. But I learned so much from him, and I'm really excited to start learning about bones and maybe answer those questions next year. I also shadowed the family doctor clinic down the street that Dr. Hans and Dr. Orchard run, I think. And it was just like the culture in that clinic is just so wonderful. You can tell that they're all friends, all their patients love them.
I really liked that people within their specialties got to do everything in their specialty, just because in academic centers, it feels like it's a little bit more siloed. Like people do fellowships after they do their residency, and that means that they only see like a specific population, or they only see a specific type of concern. So like forensic psychiatry, they only see people who are in the judicial system. But here, it seems like they get to do every part of their specialty. So when I got to shadow Dr. Ferreria, she was incredible. She was so awesome. She did inpatient and outpatient. She was also telling me about how she does emergency psych. So it's really cool. You're not limited to just seeing appointments or seeing people in their most acute stages. You really get to see the whole breadth of the specialty, and I think that's really exciting.
Yeah, so actually, I never thought that I would ever do something surgical. I always thought of myself more leaning towards the medicine side, but now that I've actually gotten to see the OR and gotten to like shadow some of the surgeons, I think their jobs are so cool, and I just think that it's so impressive how calm and collected they are when things not go wrong, but just like when things are bleeding, and when the skin is cut open, and like they're just so calm and collected and so confident in their own abilities that I really hope I can get there one day.
I feel like this was honestly just a very fantastic week.
Yeah.
Like I got to see so much that I wouldn't have seen beforehand. Like I definitely wouldn't have done like a pathology observership on my own. So getting to see pathology for a little bit was really cool, and honestly like sparked a bit of an interest in pathology for me. So I think that was really, really cool, getting to see stuff that even though we didn't specifically ask to see it, it was almost like she knew that we would want to see it.
Yeah, definitely. Yeah, a lot of the same sentiments, me with surgery, I didn't really think that I would like it all that much, but I turned out to really like it. But also, I've noticed that the people in this community are just so nice. Whenever the doctors would introduce us, they would ask, I have a medical student with me, is it okay if they come in? And they're like, oh my God, yeah, absolutely, of course, whatever it takes for them to learn. And like the community members are just also happy to have us here, even though we're just kind of like spying in on their medical issues. Yeah, I think that's like a general trend I've seen, where everybody's just like really happy to have us here.